If you've heard me say it once by now, you've heard me say it 1,000 times. The ideas are out there. The model is out there. We just need to integrate these ideas and these models to solve our current problems and our current needs in New Brunswick and in Saint Croix. Today's going to be a whirlwind. I don't want to waste any time. I've titled this, What is a Community Health Center? If you've never heard of it, what is it? If you've never heard of it, you think this is a revolutionary idea. It is not, and I want to show you, again, going from Australia all the way to New Brunswick in 5 minutes, because this is our Live for 5, episode 29, how community health centers are changing care for the better all over the world, and especially in Canada. And for some reason, we have not seen this take hold and become as widespread in New Brunswick as it should. Okay, so I want to move on here to Australia. Over 10 years ago, Australia, federally, I understand we're talking about a whole country here, but because they have urban centers and rural centers all throughout the country, the continent, really, and I've mentioned how Saint Croix, New Brunswick, is 50% rural, right? And our populations are rural, and most of, I would say, the funding and the attention, especially for healthcare, goes into the major cities. That status quo is just not good enough. So let me read from what's on the screen here from the government of Australia and how they have tackled their challenges, again, years ago, with the idea of general practitioner super clinics. This is a program that they ran. I'm reading from the screen here. Funding of GP super clinics is a key element of building stronger primary health care. Around $650 million was committed to build 60 GP super clinics around Australia. The program funding had to be used to build, renovate, or expand a facility used for a GP super clinic. So as you hear this, I want you to imagine and think about our current challenges in New Brunswick, including renovating older facilities or starting up new ones, breaking ground. The federal government, again, this is federal, I understand, but the province can lobby and the province can come up with a plan. They're on a 5-year plan right now. We're right in the middle of it. And I'm not seeing shovels in the ground going into Saint Croix. That grieves me. But again, as your MLA, I know that I will not let this happen. And so this is just some detail around the GP super clinics. Does not fund the ongoing service provisions. So these clinics come up with other funding, and the government doesn't own or operate GP super clinics. Now, let me go to the next little tidbit of information, the final one for Australia. The goals of the program, the GP super clinic program that started over 10 years ago, was to build a more efficient primary healthcare system. Sound familiar? We need that. Lower the rates of avoidable hospital admissions. Sound familiar? We need that. Reduce health inequalities. Oh my gosh, that is a huge problem in Saint Croix. Access, as we've talked about, and cities over rural, and then improve health outcomes. That is something that the Greens, we've talked about being preventative. It's that whole idea of an ounce of prevention is worth a pound of cure. And that is the situation that we've been looking at for years. And this is how Australia has handled it. So that is Australia, 60 GP super clinics. You can read the data of how it has improved access and all those outcomes in their healthcare system. Now, a little closer to home, let's move to Canada. A bit of a history lesson here. In Canada, community health centers grew out of a local community organizing. Okay, this is why you need an MLA who is going to organize and advocate and champion this. For some reason, it is not being done. We needed this done yesterday, i.e. 5-10 years ago. But we are going to get that changed, especially in low-income areas where community members identify the need for better access to comprehensive primary care services. That's how CHCs came about in Canada. Recently? No, look at the next paragraph. The first Canadian CHC was established in 1926. Today, there are 300 CHCs represented by the Canadian Association of Community Health Centers. This is an organization that we could tap. It again, the model and the idea are out there. That is why I'm bringing this to your attention. CHCs have a long history of growth and sustained support by government, including core funding of just over 400 million in 2016 and 17, 96 million. So this is some of the older numbers, but I just wanted you to see how in Ontario, CHCs serve about 500,000 patients a year, or only 4% of the Ontario population. Okay, so how much more could we bring one into Saint Croix, as I said, for our 25,000 plus residents, and be serve well over half of us? Again, I don't have a family doctor. You probably don't either. If the statistics bear out, we need this in Saint Croix. One more slide on the screen from this. A 2012 study from Ontario's Institute of Clinical Evaluative Studies describes, compared with the Ontario population, CHCs, community health centers, served populations that were from lower income neighborhoods, had higher proportions of newcomers, and those on social assistance had more severe mental health illness and chronic health conditions, and had higher morbidity and comorbidity. This is showing the level of need and how these CHCs rushed in to fill that need, again, alleviating the overall healthcare system and the burden on the system, which was really important and continues to be in New Brunswick. Now, I am seeing that I'm at 5 minutes, and we went from Australia to Canada in general. Part 2 tomorrow, because I want to respect your time. I want to talk about BC's model, where I've talked about how they have departments focusing around rural concerns, which why hasn't this been done in New Brunswick? We are quintessentially rural. And then I want to focus on one incredible CHC in New Brunswick, which again, I'm full of optimism. It's one of those things you might as well laugh as cry. It hasn't been done yet. We can focus on that. We can point fingers. There should be plans and shovels on the ground. You see how with like the Passamaquoddy Lodge, as I discussed, plans are made. Everything's in place for 2023. The government just doesn't get things going, get things done. And we have Green MLAs standing up in the House, always saying, what's going on? Let's get these things done. I will do that for our riding in Saint Croix, because the status quo is just not good enough. We need to have courage to vote for change and participate together. You saw how CHCs came about in Canada from community organizing. And we're doing it for a common good, because if it's not a good idea for everyone, it's just not a good idea. And that's what we're going to change. Thanks, everyone. Have a wonderful day. I will see you tomorrow for part 2 of What is Community Health Center?